In this video, we'll discuss about cellulitis. So, cellulitis is basically a type of infection which is non-suppurative in nature and it spreads along subcutaneous tissue and facial planes. So, this area is going to be affected by cellulitis. Okay, now it is caused by Staphylococcus aureus and Streptococcus pyogenes and other species. Now what they release is streptokinase and hyaluronidase. Now this further leads to the breakage. Now this is mostly seen in loose subcutaneous tissue as in scrotum or in loose interstitial tissue, face, forearm, and it spreads very fast. Also, the net result is going to be a gross swelling. So, coming on to the sources of infection. In sources of infection, it can spread by injuries, then graze or scratch, snake bite. Then coming on to the predisposing factors, first is diabetes mellitus, immunosuppression, obesity, lymphedema, then tinea pedis. Also, if there is history of mastectomy. Now coming on to the common sites we have discussed. Now coming on to the clinical features. In clinical features, just remember the Eron's classification properly. Now what is this classification about? It divides them into classes. Class 1, 2, 3, 4. In this what we see is there is no systemic toxicity. No systemic toxicity. Also no comorbidity. It is present in both. In this it is increased present, and in this it is sepsis and life threatening situation in class 4. Okay, now let's talk about the other clinical features, the presentation. Now what happens is there is the presence of inflammatory signs, that is there is redness, itching. Also, where the swelling is present, the skin appears to be shiny and stretched. This is a very important point to remember. Then, secondary factors like pain, fever, okay, then toxemia. Then, it can also, in severe cases, suppuration, slowing, slogging, gangrene formation. Now, a very commonly asked question in Viva is what is the difference between cellulitis and abscess? Now, in cellulitis, there is no limit, there is no margin, no edge basically, and there is no pus, there is no fluctuation. Whereas in this, what we see is limit is present, there is a well circumscribed edge, well circumscribed edge. Pus is also present, fluctuation is also positive. Now in treatment, for the treatment what we do is first of all bed rest with legs elevated. This will reduce the edema of leg. Then MgSO4 dressing, this will do the same thing. Then antibiotic prophylaxis, that is penicillin, 20 to 24 million units, or 10 to 12 lakhs 6 hourly. All right. Then there is one more thing which is called as orbital cellulitis. Now, what is this? This usually, what happens is, in this proptosis occurs, and then this further leads to blindness. All right, this needs to be corrected on time. Now, coming on to the complications. In complications, if the patient has diabetes mellitus, so he is more prone to undergo diabetic ketoacidosis. Then there can be abscess formation. Also, very important, necrotizing fasciitis. We will discuss it about in a video. This is basically the flesh-eating disease. Also, one more thing can occur, which is the KAN. That is traumatic. Um, Necrotizing, yeah, toxemia and septicemia. So this completes the cellulitis. In next video we'll cover the Ludwig's angina. I hope you understood. Thanks for watching.